Welcome to this Frequently Asked Friday. I'm Bianca and I'm a senior consultant at QServe. Today I'm joined by a guest speaker, Páll Jóhannesson from Smartwile, which is located in Aalborg, Denmark. We received some interesting questions on post-market clinical follow-up, and then especially surveys and studies. As Smartwile provides a toolbox to collect data from clinical studies and surveys, we thought it would be interesting to hear your perspective on those questions.
Excellent. Thank you very much.
And the first question, how do you determine sample size for post-market clinical follow-up trial, especially a survey, and what role do product sales numbers play into this?
This is an interesting question, and I do think we need to start at the rear end of the question in terms of the product sales numbers, because you need to be, when you're doing a survey or whenever you're doing a PMCF activity, you need to also be realistic. So maybe not only the product sales numbers is the question, but also how much is my device used, or what is the potential number of cases that we could in theory get, or what is the potential number of treatments done by a similar device in the market, for example. So the product sales numbers definitely play a role, because you cannot, if you calculate a sample size, say we need 200 cases, but there's only 10 per year, well, you will never be done. Then you cannot, never get this data that you need. So I guess that's one part of the equation, that you also need to be realistic if it's possible to actually do a good sample size calculation. But to bring it back to the first part of the question, then of course, rule number one is to seek expert advice. Involve a biostatistician if you are having trouble with making the calculation, but also start asking yourselves the question, what do we want to prove? Do we want to prove we are superior to something, or that we are not inferior to something, or what is our hypothesis? And then when you've come up with your hypothesis, you can sit down and say, okay, now we have to make our null hypothesis, and then we need to select the appropriate method for doing the sample size calculation. And without diving too much into the appropriate methods, because that is very specific for on a case-to-case basis, I guess it's important at least to, for everybody to sit down and think, okay, what are we trying to obtain or achieve with this? Are we trying to prove something? Do we have a claim we want to make sure that we can prove that we support? Or is it that we want to kind of make sure that we are at least not worse than what we say we are, or at least not worse than some other treatment in the market? So it all comes down to the hypothesis that you're trying to put out there. And then based on that, it's a biostatistician will fairly easily, I would say, select the appropriate method and do the final calculation. It's not rocket science, but on the other hand, you want to make sure that you have a full understanding of the concepts behind this statistical evaluation, because it is a mathematical method, and you need to have at least an idea of what you're doing in terms of this calculation to make sure that you have confidence in the numbers that you put out.
And that's clear. So in summary, make sure you have a hypothesis, get it supported by statistics, and be very careful in promising something, planning something that is realistic, and not saying we will do 200 devices where you will only sell 10 devices a year.
Exactly.
That's clear. The second question, how do you get responses from your survey?
Well, this is a very interesting question to me, because there's a little bit of psychology actually in this question. You have to sit down and think, how do I motivate responders to give me a response to a survey? This is very well known from marketing surveys, or from other parts where you do surveys, that getting people to actually take time and sit down and answer questions needs them to be motivated. So the way you need to think is that, how do I motivate my potential responders, if they are clinicians or if they are patients, to actually give me this data? How can I market or brand my survey in a way that I make sure that they are actually interested in giving me the data? Usually people are very straightforward. What's in it for me? Why should I give you this response? clinicians around Europe are being, I would almost say, bombarded with requests to give data on legacy devices at the moment for claims that have maybe not been covered by other clinical evidence. So you need to think, okay, how can we first of all make it easy for them to give us the data? How can we, select the appropriate method or make it available to them on their, conditions, on their terms, instead of just on ours? We cannot just take and take and take. We need to make sure we are designing our methodology and using the right tools to do the data collection on the responders' terms, and also to think what's in it for me, but without maybe, it's hard. You cannot pay for all the data, for example. You cannot always, provide an upside or, win an iPad or something like they do in the marketing world. But it's important to sit down and think, what is the motivation? And then, of course, also communicate that motivation. Communicate that this evidence is necessary for your device to stay in the market, and it's not, the evidence is necessary to make sure that your device, is safe and works as it should. And I really think that can be the key to motivating, for example, clinicians to give the data. But it's also been proven in a lot of cases that patients are very motivated if you just tell them what you're trying to achieve with your survey. So I would say there are, three things to this. Of course, thinking about the motivation, making it easy for them to give you this, and easy also being with the right tool and not too long. So rather many short surveys than one big, in my opinion.
And thank you for the nice summary. And the last question. Yeah. What pricing model does an electronic data capture system, an EDC, need to have to make it affordable to use to study PMCF surveys? Because many of them are quite expensive.
Yes, that's correct. And there is something to consider here, because with the new ISO standard, the 14155, and also with the MDR, there's now a requirement that the data collection tools you're using are validated. And I would say that EDC systems are up against, or traditional EDC vendors are up against, the question of how are you different in your survey method than, for example, some of the other very cheap or almost free survey tools. And there is the question of validation, of course. And you have to acknowledge the fact that the validation can also be done with the very cheap tools and the free tools, but they might already be done by the EDC vendors. Now, apart from that question that you are being met with a demand of lower price, for example, such as you're mentioning, you need to also think if you can build a model, or if you can, as a buyer, demand a model that is more tailored to the needs of PMCF and especially surveys rather than clinical studies. So I don't think you can take the method of clinical studies and the pricing for them and apply them to PMCF surveys. I do think you need to be a little bit creative. And as a buyer, you probably need to ask, how do I want to pay for this? How maybe, is paying per month acceptable? Maybe in some cases, or is it paying per case, or is it paying per response? And if you're working with, some CRO or some consultants, you also need to ask the question, okay, can we have a price for just getting the data? Or can we in some way try to make sure that it doesn't go out of hand? Because the difference with PMCF and surveys, from clinical studies, is that in clinical studies you have clinical trial agreements with the sites, and you can put some requirements to them, and you can say you have to do this and this and this. But for the PMCF surveys, it's very hard for you to demand anything of people. You cannot say that you have to go get 10 cases or 20 cases because you might not have such an agreement. And therefore you need to think, okay, if we're paying per month, and we have no guarantee that we're going to get the number of cases in this X amount of time, then maybe paying per month for a license is not the right way to go always. And then you have to be a little bit creative. I'm leaning a little bit towards something like price per case, so price per response. And then, being a software provider ourselves, I also know that software providers need to have some base revenue to make sure that they are running the service properly, that they are keeping the security in check and making sure that the validation is in order. So I guess there's no really easy answer to that question, but I would say flexibility is key going forward.
Yes, I fully agree. And coming back to one thing you said, you indicated that there is no clinical trial agreement in place, so it will be difficult to require users to complete PMCF surveys. Is that also something that you should take into account in your sample size calculation?
Yeah, that could definitely be something that can impact your survey and the way you should calculate your sample size. Because yeah, again, a little bit maybe related to the sales numbers question earlier, that you have to be realistic of what can we obtain, what do we expect, and maybe before you try to do the full sample calculation, it could be a benefit for companies to try to do a test and see, can we just get somebody to answer a yes and a no question for us, and how many can we do, and can we motivate our distributors, or who can we motivate to help us getting this data, and then based on that, build with confidence into your sample size and calculation your expectation to what you're trying to prove, and maybe looking again and saying, is it a realistic number that we get 3,000 responses? Maybe not.
Yeah, that sounds like a good option if you don't have a clue on what to expect from the survey.
Exactly.
Thank you, Paul, for answering those questions.
Thank you too.